Denise Carter?
Yes.
You stole $350,000 from 23 of your own patients over 4 years. We have the bank records. We have all of it.
Those patients trusted me. I would never do anything to harm them.
You're under arrest. Turn around.
Denise Michelle Carter was born on October 22, 1985, in Memphis, Tennessee, a city defined by its contradictions, deeply rooted in music and culture, and simultaneously marked by some of the most persistent poverty and inequality in the American South. Her mother, Patricia, worked as a certified nursing assistant at a nursing home in Whitehaven for 22 years, and her father, Gerald, drove delivery routes for a regional logistics company for 19 years. Denise was the second of 3 children growing up in a 2-bedroom house on Elvis Presley Boulevard in the Whitehaven neighborhood, a working-class community on the south side of the city where the streets were quiet and the households ran on the specific discipline of 2 parents who worked constantly and expected their children to do the same. Patricia Carter came home from her nursing home shifts talking about her residents, the way her own mother had talked about the neighbors she looked after in the community where she grew up, with the specific combination of patience and protectiveness that characterized people who had chosen caregiving as a vocation rather than a job. Denise grew up understanding that caring for elderly people was meaningful work, that it required the kind of sustained attention and genuine investment that not everyone could give, and that the people who needed care were among the most vulnerable that a person would ever encounter in a professional context. This was her mother's frame, and she absorbed it. She graduated from Whitehaven High School in 2003 with a 3.1 GPA and enrolled at Southwest Tennessee Community College in the fall, completing the licensed practical nurse program in 2005. She passed the NCLEX PN on her first attempt and worked for 2 years at a hospital in the medical district before transitioning to long-term care in 2007, drawn by the continuity of relationships that long-term care offered, the ability to know residents over months and years rather than the episodic contact of a hospital setting. She joined Riverside Gardens Senior Care in 2016 after 3 years at a smaller facility in East Memphis that had closed following a Medicare reimbursement dispute. Riverside Gardens was a well-regarded facility by Memphis standards, a 94-bed long-term care center in the East Memphis neighborhood, licensed by the Tennessee Department of Health, serving a predominantly elderly population with a mix of private pay and Medicaid residents. The clinical staff was experienced, and the turnover rate was below the state average for comparable facilities, which meant that residents and their families developed genuine long-term relationships with the nurses and aides who cared for them. Denise Carter's 8 years at the facility made her one of the most tenured clinical staff members, and her familiarity with the resident population was genuine. She knew their histories, their preferences, their families, and the specific rhythms of their daily lives in ways that took years to develop. She was, by every assessment available to anyone looking at her professional record, a good nurse. Riverside Gardens' voluntary personal property management program was a standard feature of long-term care facilities serving residents who lacked consistent family support. Residents or their designated representatives could authorize a staff member to assist with personal financial transactions, paying utility bills on accounts the resident maintained outside the facility, making small personal purchases, managing the resident's personal allowance account held by the facility, and in some cases handling the resident's bank debit card for transactions the resident could no longer execute independently. The program's oversight mechanism was documentation. Staff members who participated were required to maintain a transaction log for each resident they assisted, recording the date, amount, and purpose of each transaction. The logs were reviewed quarterly by the facility's business office manager. The review process was designed to catch obvious anomalies, large unexplained withdrawals, transactions inconsistent with a resident's known needs and expenses. The specific vulnerability that Denise Carter Carter exploited was the gap between the transaction log she maintained and the actual bank account activity she was generating. She documented selected transactions in the log, the ones that were routine and expected, the utility payments and small personal purchases that the quarterly review would validate without question, while conducting additional transactions that she did not document. The undocumented transactions were executed using the resident's debit card, which she retained in her possession between visits to the bank, and through online account access that residents had authorized her to use for specific purposes, but that she was using for others. The quarterly review compared her transaction logs against the logs of other participating staff members and against the facility's internal accounting records. It did not compare her transaction logs against the resident's actual bank statements. That comparison would have required the facility to obtain bank statements for each participating resident on a quarterly basis, a process that the program's design had never incorporated and that the business office manager had never been asked to implement. Denise Carter understood this gap precisely. She had participated in the program since her second year at Riverside Gardens and had watched 2 quarterly reviews without any cross-referencing of bank statements against transaction logs. The oversight relied entirely on the good faith of the staff member maintaining the log and the quarterly reviewer's assumption that the log was complete. The first theft happened in January 2020. A resident named Dorothy Barnes, 84 years old, mild to moderate dementia, no family members living within 2 hours of Memphis, had authorized Denise to manage her personal bank account debit card for routine transactions. Denise made a legitimate transaction on January 14th, a $47 payment to a utility company that she documented in Dorothy's transaction log. 2 days later, she made an ATM withdrawal of $400 from Dorothy's account at a branch in Midtown Memphis, a location Dorothy had not visited in 3 years. She did not document the withdrawal. The transaction appeared on Dorothy's bank statement, which no one at the facility reviewed. Dorothy Barnes could not have identified the missing funds. Her dementia had advanced to the point where she did not have independent access to her bank statements and would not have been able to interpret them if she had. She noticed nothing. She said nothing. The quarterly review processed Denise's transaction log, found it consistent with expected activity, and closed without follow-up. Denise told herself it was a one-time bridge. She had a car repair bill that had arrived before her paycheck, and she would replace the money within the month. She did not replace it, and by March 2020, she had made 3 additional withdrawals from Dorothy Barnes's account totaling $1,200, and had begun making similar withdrawals from 2 other residents' accounts whose debit cards she also managed. By the end of 2020, she had stolen $47,000 from 6 residents. By the end of 2021, the total had reached $128,000 across 14 residents. By the time Michelle Tran pulled her grandmother's bank statements in November 2023, the total across 23 residents was $350,000, drawn through 47 documented transactions that included ATM withdrawals, online retail purchases delivered to Denise's home address in Cordova, and 6 personal checks bearing forged signatures that she had deposited through mobile banking applications using her own phone. The money went to a pattern of spending that her $48,000 annual salary at Riverside Gardens could not have supported. A leased Chevrolet Tahoe at $890 per month, a 2-bedroom apartment in Cordova at $1,450 per month, a vacation to Cancun in 2022, private school tuition for her daughter at a Christian academy in East Memphis at $7,200 per year, and a series of online retail purchases, clothing, electronics, home furnishings, that her bank records would later show averaging $2,300 per month above what her legitimate income could account for. Her colleagues saw a nurse who had done well for herself. Her supervisors saw a reliable, experienced staff member who who had never generated a complaint. Her residents saw the person they trusted most with the parts of their lives they could no longer manage independently. There were 2 moments where the operation almost came apart before Michelle Tran's discovery forced the issue. In March 2022, the facility's business office manager, a woman named Sandra Webb, noticed during a quarterly review that the transaction log for a resident named Harold Morrison, 79 years old, Parkinson's disease, limited family contact, showed fewer transactions than she would have expected given Morrison's known personal expenses. She flagged the discrepancy informally to Denise, asking whether Morrison had reduced his personal spending or whether there were transactions that hadn't been captured in the log. Denise told her that Morrison had recently decided to reduce his personal purchases following a conversation about his long-term financial planning and that the log accurately reflected his current transaction volume. Webb accepted the explanation and closed the quarterly review. She did not pull Morrison's bank statements. In August 2023, a resident named Gloria Patterson, 82 years old, early-stage dementia, whose daughter visited monthly from Nashville, mentioned to her daughter during a visit that she thought some money had come out of her account that she didn't remember authorizing. The daughter, who worked in retail management and had no particular financial background, asked Denise about it during the same visit. Denise told her that there had been a billing adjustment on Gloria's utility account that had required an additional payment, that it had been documented in the transaction log, and that she would pull the documentation for her. She produced a transaction log entry the following day that described the utility payment with a plausible amount and date. Gloria's daughter accepted the explanation. She did not pull her mother's bank statements. She did not contact the facility's management. She returned to Nashville. Neither moment produced a formal investigation, and neither moment came close to the actual mechanism. November 18th, 2023. Michelle Tran was 34 years old, a licensed CPA working at an accounting firm in East Memphis, and the granddaughter of Linda Tran, 87 years old, a Vietnamese-American resident at Riverside Gardens, who had lived at the facility for 3 years, following a stroke that had left her with significant mobility limitations and moderate cognitive impairment. Michelle visited her grandmother every 2 to 3 weeks and had developed a familiarity with the facility's routines and staff over 3 years that made her comfortable with the care Linda was receiving. On November 18th, she was reviewing her grandmother's finances as part of an annual check-in on Linda's accounts, a practice she had maintained since Linda's admission to the facility, driven by the professional habit of a person who worked with financial records daily and applied the same attention to her grandmother's situation that she applied to her clients. She pulled 3 years of bank statements from Linda's checking account and began reviewing them against the transaction log that Denise had maintained. She found 47 transactions in the bank statements that did not appear in the transaction log. ATM withdrawals at locations in Midtown Memphis and Cordova that Linda had not visited. Online retail purchases at addresses that were not Riverside Gardens. And 2 personal checks totaling $8,400, bearing signatures that Michelle recognized immediately as inconsistent with her grandmother's handwriting. Linda's signature had deteriorated significantly following her stroke, and the signatures on the checks showed none of that deterioration. Michelle Tran called the Tennessee Bureau of Investigation at 4:22 p.m. on November 18th, 2023. She provided the investigator with a summary of what she had found, the account statements and photographs she had taken of the 2 forged checks. The investigator assigned to the case, Special Agent Raymond Torres, opened a formal investigation the following morning and requested financial records from the facility under a subpoena issued on November 21st. Torres's investigation moved systematically. Within 2 weeks, he had subpoenaed Denise Carter's personal financial records across 2 banks and identified the pattern of deposits, structured to avoid currency reporting thresholds, distributed across accounts in her name and a joint account she held with her sister. sister. That corresponded to the withdrawals from resident accounts. Within 3 weeks, he had identified all 23 affected residents by cross-referencing the transaction logs Denise had maintained against the actual bank statements for each resident in the program. Within 4 weeks, he had identified the 6 forged checks and obtained handwriting analysis confirming the forgeries. The full financial reconstruction was complete by January 2024. $350,000 across 23 residents over 4 years, drawn through 47 documented transactions and an unknown number of smaller transactions that could not be definitively attributed, but that the pattern analysis strongly suggested. The Chevrolet Tahoe, the Cordova apartment, the Cancun vacation, the private school tuition, all of it traceable to cash flows that had no legitimate source in Denise Carter's documented income. The arrest was scheduled for the morning of February 11th, 2024, timed for a mid-shift arrival at Riverside Gardens when Denise would be present in the facility. Her passport had been flagged at the border database on January 30th. February 11th, 2024. Denise Carter had just come out of a residence room at 10:23 a.m., clipboard in hand, and was walking toward the nurse's station when 2 TBI agents entered the facility corridor from the side entrance. She stopped when she saw them. Her eyes went to the badges. Her weight shifted. The lead agent addressed her by name and asked her to confirm her identity. She confirmed it and asked what was happening. The agent told her she had stolen $350,000 from 23 of her own patients over 4 years, that they had 4 years of bank records and that they had all of it. Denise's clipboard lowered. Her hand moved briefly to her badge lanyard and dropped. She told the agent that those patients had trusted her and that she would never do anything to harm them. The agent told her she was under arrest and told her to turn around. She looked down the corridor toward the resident rooms. The doors she had walked through every shift for 8 years, the handrails installed for people who needed them, the institutional quiet of a building where the residents were having their morning medication. Then she set her clipboard on the nearest surface and turned around. The handcuffs clicked at 10:27 a.m. in the corridor of Riverside Gardens Senior Care. 2 residents whose rooms faced the corridor watched through their doorways. Neither of them fully understood what they were seeing. One of them asked a passing aide if Denise was coming back. The aide said she didn't know. The grand jury returned a 31-count indictment against Denise Michelle Carter on March 5th, 2024. 23 counts of theft from a vulnerable adult under Tennessee statute, 6 counts of forgery, and 2 counts of money laundering for the structured deposits. Maximum exposure, 78 years. She was released on $120,000 bail, secured by her sister's property. Her nursing license was suspended by the Tennessee Board of Nursing the same day. Her attorney, a criminal defense specialist named James Monroe, filed motions to suppress the bank records obtained through the TBI subpoena, arguing that the subpoena had exceeded its authorized scope. Denied. Motions to exclude the handwriting analysis of the forged checks on the grounds that the methodology had not been disclosed to the defense with adequate notice. Denied. After a brief evidentiary hearing on August 14th, 2024, Denise Carter changed her plea to guilty on all counts. The plea agreement called for a sentencing recommendation of 4 to 6 years. The Chevrolet Tahoe was surrendered to the court as a forfeitable asset in September 2024. The joint account held with her sister, which contained $34,000 that the financial reconstruction attributed to resident funds, was frozen, pending the outcome of the case, and subsequently forfeited. Her sister was not charged with any offense. Investigators determined she had not been aware of the source of the deposits. Sentencing was November 19th, 2024. Judge Angela Morrison presiding. Courtroom 4 at the Shelby County Criminal Justice Center in Memphis, Tennessee. 14 family members of affected residents submitted written impact statements. 7 appeared in person. Michelle Tran spoke for 5 minutes. "My grandmother came to this country from Vietnam in 1979, she said. She worked for 40 years. She saved carefully. She trusted the people who cared for her when she could no longer care for herself." She looked at Denise Carter. "My grandmother still asks about you. She doesn't understand what happened. She remembers you as someone who was was kind to her. I don't know how to explain to a woman with dementia that the person she trusted was stealing from her for 4 years. That is not something you can explain. That is something you did to her and to every person in this room. A man named Gerald Washington, whose mother, 88 years old, had died in March 2023 without knowing her account had been drained of $23,000, submitted a written statement. It was 3 sentences. My mother saved that money over 60 years. She never spent it on herself. She told me she was saving it for her grandchildren. Judge Morrison addressed Denise Carter directly. Ms. Carter, the residents you stole from were among the most vulnerable people in this city. Elderly, isolated, cognitively impaired, and entirely dependent on the people they trusted with their finances. The program that gave you access to their accounts existed because those people needed help, and because the system assumed that a licensed nurse with 8 years of service at a reputable facility could be trusted with that access. She paused. You used that trust systematically, over 4 years, against 23 people who had no way to detect what you were doing and no ability to stop it. 2 of them died without knowing. That is not a detail this court will minimize. She folded her hands. You were not underpaid. Your compensation was consistent with your position and your experience. You chose to steal from people who could not protect themselves because the mechanism was available and the oversight was inadequate, and you had correctly identified that nobody was comparing your transaction logs against the actual bank statements. That calculation was correct for 4 years. It was wrong on November 18th, 2023, because a granddaughter who happened to be an accountant pulled 3 years of bank statements and asked a question that the quarterly review had never asked. The sentence: 5 years in the Tennessee Department of Correction, 2 years supervised release, $350,000 in restitution to the affected residents and their estates, permanent revocation of her nursing license in Tennessee and all reciprocal states, lifetime ban from employment in any licensed healthcare or financial management capacity involving vulnerable adults. Denise Carter showed no visible reaction at sentencing. Her mother, Patricia, was in the gallery. She had worked as a certified nursing assistant for 22 years and had never generated a complaint. She did not look at her daughter during the sentencing. She looked at the judge. Denise Michelle Carter was transferred to the Shelby County Correctional Center on December 10th, 2024, pending transfer to a state facility. She will be eligible for parole in 2027. She will be 42 years old. She will owe $350,000 she cannot pay. The forfeited assets, the Tahoe and the joint account, covered $94,000 of the restitution. The remaining $256,000 is outstanding. Her daughter, who had attended the Christian Academy in East Memphis on tuition paid with stolen funds, was transferred to a public school in January 2025. She is 11 years old. Patricia Carter retired from her nursing assistant position in January 2025, 2 months after the sentencing. She has given no public statements. She has not visited her daughter since the arrest. Riverside Gardens Senior Care implemented new oversight protocols following the case. All staff participating in the Personal Property Management Program are now required to submit transaction logs that are cross-referenced monthly against the actual bank statements for each resident in the program. The comparison that the quarterly review had never performed, and that would have detected Denise Carter's undocumented transactions within the first month of the theft. The cross-referencing is conducted by the business office manager and reviewed by an outside accounting firm on a quarterly basis. The program's participation is now limited to staff members with a minimum of 3 years of facility tenure and no prior disciplinary history. Sandra Webb, the business office manager who had accepted Denise's explanation in March 2022 and closed the quarterly review without pulling Harold Morrison's bank statements, was not disciplined. She was retrained. She implemented the new cross-referencing protocol herself and has conducted every monthly review since February 2024 without exception. Michelle Tran's grandmother, Linda, continues to live at Riverside Gardens. She is 88 years old. Her cognitive impairment has progressed since the arrest, and she no longer consistently recognizes Michelle during visits. She still asks occasionally about the nurse who used to help her with her bank account. Michelle has not told her what happened. She has said in one interview that she does not know what good it would do. The 2 residents who died during the period of the the theft, Dorothy Barnes, who died in September 2021, and a man named Arthur Coleman, who died in February 2023, are represented in the restitution order by their estates. Dorothy Barnes had no surviving family members to receive the restitution payment. The court directed those funds to a Memphis elder care advocacy organization. 8 years at Riverside Gardens, 4 years of theft, 23 residents, $350,000, 2 people who died without knowing, and a granddaughter who happened to be an accountant who pulled 3 years of bank statements on a Sunday afternoon in November and asked a question that 4 years of quarterly reviews had never thought to ask. Stories like this don't get the attention they deserve, and if you want to see more accountability coverage, the cases that expose how institutional trust gets exploited by the people hired to maintain it, subscribe and hit the notification bell.